What if the biggest threats to your life after 75 are not sudden accidents, but small habits repeated every single day? Most people believe aging automatically means weakness, sickness, and dependence. But the truth is more complicated than that. Many older adults in America live well into their 80s and 90s with energy, independence, and sharp minds. Others begin declining much earlier, not because of one dramatic event, but because silent risks slowly build up over time. After 75, the body changes in ways that are easy to ignore at first. Muscles shrink faster, recovery takes longer, the immune system reacts differently, sleep becomes lighter, balance becomes less stable, even thirst signals become weaker. And when several of these changes happen together, ordinary problems can suddenly become life-threatening. But here is the encouraging part. Many of the most common causes of death in older adults are connected to risks that can often be reduced. Not eliminated completely, because nobody can promise perfect health, but reduced through awareness, daily habits, medical attention, and smart lifestyle choices. In this video, we are going to explore the most common causes of death after 75, why they become more dangerous in later life, and what practical steps may help lower the risk. Some of these may surprise you, others may already be affecting someone you love right now without anyone noticing. And if you stay until the end, you may realize that healthy aging is less about chasing youth, and more about protecting the small abilities that keep life meaningful. Walking confidently, breathing comfortably, thinking clearly, staying connected, and waking up each morning with purpose. Growing older does not mean giving up on health. In many cases, small daily decisions can make a meaningful difference over time. Today, we'll look at the biggest health risks after 75 and discuss realistic ways older adults may help protect their quality of life and independence. 1. Heart disease. Still remains the biggest threat. Heart disease continues to be one of the leading causes of death in older adults, especially after age 75. What makes it dangerous is that it often develops quietly over decades. Many seniors assume that if they are not experiencing chest pain, their heart must be fine. But heart disease can show up in subtle ways: unusual fatigue, shortness of breath while walking, dizziness, swelling in the legs, or reduced stamina. As people age, blood vessels naturally become stiffer. The heart has to work harder to pump blood efficiently. Conditions like high blood pressure, diabetes, and high cholesterol place even more strain on the cardiovascular system. Years of inactivity or poor sleep can increase the burden further. One of the most important protective habits is regular movement. This does not mean intense exercise. Even daily walking, light stretching, chair exercises, or gardening may support circulation and heart function. Staying socially engaged also matters more than many people realize. Isolation and chronic stress may affect blood pressure and inflammation over time. Another overlooked issue is medication management. Some older adults skip medications because they feel fine, while others accidentally mix prescriptions incorrectly. Regular medical reviews can help reduce dangerous complications. Protecting the heart after 75 is often less about dramatic fitness goals and more about consistency. Balanced meals, manageable movement, proper sleep, routine checkups, and staying connected to others. 2. Cancer becomes more complicated. With age, cancer risk increases with age because the body has had more time to accumulate cellular damage. After 75, the immune system may also become less effective at detecting abnormal cells early. The difficult part is that cancer in older adults may not always present obvious symptoms at first. Weight loss, fatigue, loss of appetite, or mild pain may be mistaken for normal aging. Because of this, some cancers are discovered later than they should be. Lung, colorectal, prostate, pancreatic, and breast cancers remain among the more common forms seen in older populations. Smoking history, poor diet, inactivity, alcohol use, environmental exposure, and family history can all contribute. Reducing risk does not require perfection. Quitting smoking, even later in life, may still provide benefits. Eating more fiber-rich foods, fruits, vegetables, and protein may support overall health. Limiting excessive alcohol intake may also help lower certain risks. Routine screening should be discussed individually with healthcare providers. Because recommendations can vary based on overall health and medical history. Some seniors avoid doctors because they fear bad news, but early detection may sometimes lead to simpler treatment options and better quality of life. Perhaps most importantly, older adults should not ignore persistent changes in their bodies simply because of age. New symptoms deserve attention. 3. Falls can become life-changing events. Many younger people think of falls as embarrassing accidents. After 75, a fall can completely change someone's life. A broken hip, head injury, or severe fracture may lead to hospitalization, surgery, long recovery periods, or permanent loss of independence. Some older adults never fully regain their mobility after a major fall. The danger is not only the injury itself, it is the chain reaction that often follows: reduced movement, muscle loss, isolation, depression, and increased frailty. Balance naturally becomes less stable with age. Vision changes, slower reaction time, weaker muscles, medications, poor footwear, and cluttered homes all increase fall risk. One of the best defenses is strength preservation. Maintaining leg strength and balance can make a huge difference. Simple exercises, walking regularly, and practicing controlled movements may help maintain stability. The home environment matters too. Loose rugs, dark hallways, slippery bathrooms, and electrical cords can become serious hazards. Something as simple as better lighting or grab bars in the bathroom may prevent a devastating injury. Many seniors also avoid using hearing aids or mobility devices because they fear appearing old. But tools that improve stability and awareness may actually help preserve independence longer. 4. Pneumonia and respiratory infections become far more dangerous. A respiratory infection that a younger adult recovers from in a week can become life-threatening for someone over 75. As the immune system ages, the body often responds more slowly to infections. Lung function may decline, and recovery can take much longer. Conditions such as COPD, asthma, heart disease, or previous smoking damage can increase vulnerability, appear differently in older adults. Instead of high fever or severe coughing, an infection may first appear as confusion, weakness, loss of appetite, or sudden exhaustion. Hydration becomes especially important because dehydration can worsen illness quickly. Many older adults also underestimate how important sleep and nutrition are for immune health. Vaccinations, proper hand hygiene, avoiding smoking, and seeking medical attention when breathing changes suddenly may help reduce serious complications. Staying physically active may also support lung strength over time. Social gatherings matter emotionally, but crowded indoor environments during peak illness seasons may increase exposure risk. Smart precautions are not about fear, they are about protecting resilience. Aging after 75 comes with challenges, but small daily choices can still make a meaningful difference. Take care of your body, stay connected to others, and never underestimate the power of healthy habits. If you found this video helpful, don't forget to like, subscribe, and share it with someone who may need to hear this today.